Kinard, and I'm here to present my capstone and 5-year plan for the baccalaureate program at Lamar University. I have been a registered nurse for the past 21 years. I am currently the Regional Clinical Manager for the Department of Corrections. My previous work history includes being a staff nurse at a 300-bed all-male geriatric facility for 3 years, and then I was promoted to the Director of Nursing at the same facility for the next 3 years. Once again, upon promotion, I was promoted into the position of Health Services Administrator for 2 larger male facilities in the same system. My last promotion prior to this position was to Regional Administrator in the same system for 5 male adult facilities and 3 work release sites. I have really enjoyed the baccalaureate program at Lamar University and look forward to graduation. During the baccalaureate program at Lamar University, we have learned 5 learning constructs. The first construct is Humanities and Society. It is covered in learning outcome number 1, which states that the nurse practices safe and effective holistic patient-centered care to a variety of patients and clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. This is covered by Nursing 4321, Nursing Theories and Online Education. The assignment that covered this outcome was the Insight Essay questions, where I reviewed multiple nursing theories in multiple settings to provide safe and effective care. The learning outcome was also covered in Nursing 4316, Comprehensive Holistic Health Assessment, and the Healthy People 2020 Objectives. In this assignment, I identified a needle exchange system and the issuing of condoms as 2 interventions for HIV prevention in a correctional system with over 20,000 patients. This outcome was 99% met. The second construct is the Lifespan Health Continuum. It is covered in learning objective or learning outcome number 2, which states that the nurse supports patients and clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. This is covered by Nursing 4620, Compromised Multiple Health States. The outcome was covered by practical reflections on lupus and rheumatoid arthritis, which consisted of reading a memoir on lupus and interviewing a patient with rheumatoid arthritis. Then I was able to develop a care plan to prevent other diseases, promote management of the current disease, and to maintain wellness. The learning outcome was also covered in Nursing 4316, Comprehensive Holistic Health Assessment. In this assignment, I completed a nursing assessment of each body system and then a comprehensive assessment of each body system at the end. This outcome was 99% met. The second construct also includes learning outcome number 3, which states that the nurse evaluates patient-centered care for patients and clients across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health. This is covered by Nursing 4540, Care of Communities. The outcome was covered by a practical teaching plan for disaster preparedness for several COPD patients housed in an aged and infirm prison facility. This teaching plan included the needs of the population if housing in place or if being evacuated during a natural disaster such as a tornado. This outcome was also covered in Nursing 4620, Compromised Multiple Health States, which consisted of practical reflections on lupus and rheumatoid arthritis. These reflections included reading a memoir on lupus and interviewing a patient with rheumatoid arthritis, then identifying problems and developing a care plan for pain management and another care plan for a knowledge deficit related to exercise in the rheumatoid arthritis patient. This outcome was 99% met. The third construct is the evidence-based practice and clinical reasoning construct. It is covered in learning outcome number 4, which states that the nurse synthesizes clinical and judgment in nursing practice utilizing critical thinking, nursing practice, research, and evidence-based practice. The outcome was covered by Nursing 4390, Nursing Inquiry and Evidence-Based Practice. Assignments that satisfied this outcome included critiquing a quantitative research report, answering discussion questions on qualitative research using evidence-based practice, and testing on qualitative research concepts, measurements, and analysis. This outcome was 99% met. The fourth construct is the patient client-centered care construct. It is covered in learning outcome number 5, which employs safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients and clients and members of the interprofessional and intraprofessional healthcare team. This is covered by Nursing 4321, Nursing Theories and Online Education. The outcome was covered by the APA paper that discussed the meaning of nursing by using the nursing meta paradigm and how it relates to the person, health, nursing, and environment in delivering care. This outcome was also covered by Nursing 4550, Nursing Practice, Leadership, and Management in the Healthcare System. The assignment that covered this outcome was a practicum assignment where I revised a suicide prevention policy at a local prison facility. This outcome was 99% met. The fifth construct is the professional roles construct. It is covered in learning outcome number 6, which differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients and clients as a member of the interprofessional and intraprofessional healthcare team. This outcome was covered by Nursing 4321, Nursing Theories and Online Education. The assignment that covered this outcome was a discussion question on legal, ethical, and end-of-life care issues on a patient with liver cancer. This outcome was 99% met. The fifth construct also covers learning outcome number 7, which states that the nurse demonstrates professional integrity, effective communication, active inquiry, and service to the community. This was covered in Nursing 4540, Nursing Practice, Care of Communities. The assignment that covered this outcome was Community Practicum Project, in which I developed a disaster preparedness plan for several COPD patients at a local prison facility. This plan included their basic needs for housing in place or for during an evacuation. This outcome was also covered in Nursing 4580, Synthesis of Professional Nursing. The assignment that covers this outcome was the Lewis Blackman discussion question on Lewis Blackman, a 15-year-old that died from septic shock due to being administered an overdose of Toradol by the nurse. This assignment included identifying potential causes for the death and interventions that could have potentially been put into place to keep this type of error from occurring again. This outcome was 99% met. My 5-year career plan includes graduating with my baccalaureate degree in May of this year, and then being promoted to nurse administrator this year. Then I plan on enrolling for my MSN degree at Lamar University and graduating with my MSN degree in 2020. Then I expect to be promoted again to the Associate Commissioner of Health Services in 2023. For references, I used the undergraduate RN BSN student handbook for 2017 and the Texas Board of Nursing Competencies, the 2012 edition. Thank you.